Hi, I'm Dr. Kevin Cheng, founder of Osana, a health service dedicated to transforming lives through prevention. Over the years, I have reflected with colleagues on what we wish people did so they can avoid pain, surgery, or developing a chronic disease. Often the answer lies in embracing a proactive mindset and putting healthy lifestyle practices into action. By doing this, the upside is not only better health, but also saving us time, money, and stress in the long run. In this podcast, I'm joined with my friend Saxon Piggott to chat with a new health expert each week. We'll cover practical ways to look after ourselves, how to prevent illness, and ways we can be inspired to live well. Welcome to Prevention Hacks, the weekly conversation where we go to health experts for advice, so you don't have to. So Theo Backer, welcome to Osana's podcast, Prevention Hacks. Great to have you along, and you're a physio with, as you say, decades of experience. And today we are talking about a very common challenge, which is back pain.
Yeah.
And I understand, Sax, actually, you've had a bit of experience in this area.
Yeah, so I blew out my L4 and L5, so lower back, when I was in my early 20s, just picking things up badly. No idea what I was doing, and I didn't even realize that I was going to have a back issue until it finally gave out. So I guess my first question would be, what would your advice be to people who don't have back pain or back problems? Like, what should they be thinking of in order to avoid getting one in the first place?
Oh, what a great question. But it's very difficult if you don't have a problem to even conceive of what a problem is like. And people have told me that all the time. I've had men break down in the thing, go, I've always given my workers a hard time about having a bad back, and I never realised what it was like. So the two really big things, I think, is number one, like in every aspect of our lives, every bit of research that's done, not just for back pain, but for cardiovascular disease, diabetes, everything, is you need to maintain a reasonable level of fitness, a reasonable level of strength. You have to do your 20 minutes of brisk activity every day. That's the simple thing you can do. Simple in terms of you don't have to think about it too much. It's hard to make the space in your life to do that if you're a committed, I'll just lie here and wait till tomorrow person, which we all have that tendency. But that's one really big thing. And I think the other most important thing in terms of preventing injuries in back care is to think a little bit about the tasks that you're doing. We're very, as a general population, when you look at a job, to do the job, and you see this even in formal task analysis, you look at the job and you think, all right, I've got to do that, off we go and do it. Most people don't stop to think, oh, really, how long can I move those rocks for? Or really, can I pick that rock up? And so having a better conception of your own physical abilities and things that you can do in your 20s, obviously, you might struggle to do in your 50s. So, I need that rock moved in my backyard and that's 45 kilos. Okay, if you never pick up 45 kilos and that's a 45 kilo rock buried in some dirt, you're going to struggle with it. And if you try too hard, and people, the idea that if I start a job, I have to finish it, particularly a physical job like that leads to injuries because people get tired and, I've only got another hour to do, so I'll just do a little bit more. They're already starting to feel a bit tired, but they don't stop. So that ability to, before you even start a job, think, right, I'm going to do that for 20 minutes and then I'm going to stop. That's a real lifesaver for a lot of people, but quite difficult to do.
I think I'm going to use that the next time my girlfriend asks me to do something out in the backyard.
Yeah.
It's too dangerous. So I think I'll just do it for a few minutes and then we'll.
Yeah. A 15-minute slot and that's it. I'm done. Yeah, that's a really good skill to have.
I thought you were still in your 20s, Sax.
No, I wish. And that kind of resonates what you're saying there. It almost feels to me like in my life there was life before a bad back. and life after. And life after, I'm a lot more mindful of what I do and how I do it.
Yeah, it's so the technical things of keeping your shoulders over your hips and keeping your spine in some degree of extension. You know, you're not slumping, not bending over to slump. That's also really important, but that's quite difficult because unless you have a dancer sensibility of your body, you don't even realize you're bending. Even in sitting, we tend to sit slumped, and so the third thing that I'd say that goes with the fitness and be a bit mindful of your actual abilities is that if you spend all your day sitting in full flexion, bending over, and then you're bending over to pick up heavy weights, then that's inevitably going to lead to some problems as well. We need to, the sitting is our great enemy, really.
Yep, sitting is the new smoking. I'm just correcting my posture now as you're talking. I'm very conscious.
Oh, well done.
And so the next question, Theo, would be when you do get a sore back, what would you wish every patient or member of ours do before they come to see you?
Before they come to see me?
Yeah.
Oh, well, from my perspective, the thing that I really like is they've got some awareness or insight into when they have the pain and what is the nature of what they feel. It's a very natural thing to block out, oh, it hurts, I'm just not going to think about it, and I'll poddle through. So quite often I ask people, where does it hurt exactly? What does it feel like? And they're not quite sure, or what makes it worse, what makes it better. So those things are useful to think about. And on the negative side, pay a bit less attention to what Uncle Ernie said or what you read in New Idea 4 weeks ago, that sort of stuff, because often some people will catastrophize about what's going on because they've had, I read this, or my disc's blown, it's gone, I'll never get it back. And it's, well, you're not like that. The back is living tissue. It's capable of getting stronger as much as it is capable of getting weaker. So just because your back is sore does not necessarily mean that you're going to be terrible forever. So, that stuff is much more about what's going on in people's heads. And the other problem with back care, and I think this is in the research a little bit as well. There's a lot of different structures in the back that can get hurt, and the management for those different structures is different. So the concept of non-specific back pain, and you can have one intervention for all of that. Well, that's why a lot of those interventions aren't shown to be effective, because it's like saying, we just only have one intervention for abdominal pain. You have to think, is it a ligament? Is it a joint? Is it poor control? Is it just a strain? All of those things require slightly different approaches.
So is the best thing that people can do to get along and see like a physio or a doctor early, or once they know they've got a problem, so they can figure out then what's the best approach to manage it? Because I know that before I went and did that, I had all sorts of random advice from different people, and some of it was the opposite of what I should have been doing.
Yeah, that's right. You do really need to get to the bottom of exactly what's going on, because sometimes it's quite simple. It might just be as simple as just getting your tummy muscles strong and fixing your posture and not doing particular activities, and that might be enough to fix it. Or it might be just a stiff joint, in which case if it's mobilized, it's, that the mobilization, if it's a stiff joint, that sort of treatment is a little bit like a miracle. They're the ones that, I walked in and I was in agony and I walk out great. Obviously you then need to do stuff to prevent it coming back, but that being accurately diagnosed about what exactly the problem is, and then being clear in your mind about what you should do and what you shouldn't do. Whether, like for instance, if you've got a sharp pain, of course everyone's a bit different, but generally if the nature of your pain is sharp, that tends to be a joint. So even if you have a stab, it feels terrible, but it's not that serious. And if your reaction to that is to not move, then you'll get worse. So knowing that you're not doing any more damage by that sharp pain, that's a useful thing. Whereas if you've got more of a hottish pain or like a burning sense, that's nerve pain, and you definitely do not want to be aggravating that, because then you can have a full-blown neuritis, and then you are in for many months, if not years, of problems. So that sort of stuff is actually quite important to sort out, and not be too focused on not be too focused on just it's if you're not specific, then it's easy to be overwhelmed by the totality of what's going on. Whereas once you've got a clear,
there's a bit of certainty that comes. Like, there's a bit of comfort comes from knowing what the problem is too, right? So
that's
now I know
right.
what it is.
At least I understand my problem, and that's a really helpful thing. And I think that's as a physio, that's the big thing that I do with people is to be clear about, well, this is what's going on with you. So and then work from there, because this is what's going on. Therefore, you now have to do these things if you want it to go away and not come back.
I spent some time, Theo, in training to be a surgeon and doing back surgery.
Right.
I remember the consultants I worked with saying, swimming is one of the best preventative measures. What would you recommend to kind of prevent ongoing back recurrent injuries?
I absolutely would recommend swimming. Swimming is fantastic. It's non-weight bearing. You get a little bit of movement. If you're swimming well, it's core stability as well. So that's fantastic. So I would definitely recommend that. The exercise that people do most is the exercise that they enjoy most. And if they're not enjoying it, then they're not going to do it. So I do ask people, do you like swimming? And if they go, oh, no, I hate the water, well, then I don't follow up with, well, you've got to go swimming, because it's like they're not going to. The walkers need to be walking. A good Pilates classes are fantastic, but a lot of Pilates that's called Pilates, they're not actually checking your pelvic position. You do need some if you're going to Pilates, someone should be putting your hands on your pelvis and checking that you're able to maintain the position of your pelvis through that class. So if you're in that sort of class with the Pilates, absolutely fantastic, because that ability to maintain your pelvis and your spine in a good position. Everyone knows, I have to keep my spine in a good position, but most people aren't able to demonstrate what a good position is or be able to maintain it as they pick something up. So that sort of movement is really important. But I think in terms of general exercise, it's the things you enjoy doing. So if you enjoy playing a sport, that's what you should do. If you enjoy walking, that's what you should do. If you like kicking a ball against the wall, that's what you should do. If you've got little kids, well, obviously you've got to do something active with the little kids, and then that solves two birds with one stone. But I'd say be creative rather than prescriptive with your exercise. What you do doesn't seem to matter too much, according to most of the literature I read. What matters is that you're doing non-stop activity for 25 minutes, 30 minutes, and you're getting a bit breathless with that. But having said that, of course, a lot of people that we see can't do that. They can't do, they can't even do 3 minutes at a rate that makes them breathless. So for those people, it's like, okay, it's not uncommon for me to start people on, say, 3-minute walks a day and just do that for a week. And then after a week, I go, and often I'll time them, because, people will tell me, oh, yeah, I walk 20 minutes every day. And then we go, okay, let's time the walk. And after we've been going for 4 minutes, they're puffing and limping and, I didn't know you meant like walking. I don't know what you were talking about, but yeah, that's what we're talking about. So, just being realistic about what people can do and then what they want to do, and then trying to convince them that they actually should do that.
What's if you're, for the uninitiated, if somebody's now got a problem or they think they might have a problem, how do they pick a good physio?
Oh, that's such a hard question.
Right.
Because everybody's different, and I think you need to be assessed properly. I think that's the first thing. They should be asking lots of questions and doing a physical examination. They need to check where you can bend and look at you a few times. my opinion is they need to put their hands on you to feel what the bones are doing, whether there's resistance there or whether there's doing there. And they need to talk to the person about what their actual, be clear about what's actually the symptoms, and then engage with what the person is feeling rather than doing the production line things. And I don't think there's a strong role for machines or those sorts of things in terms of fixing people up. I think it's much more about exercise. The TENS and those things can help for pain relief, but they won't actually fix the problem.
And your objective there then as the patient should be to be able to figure out what the problem is and come away with a management plan. Is that
That's right? Yeah. So with the clinical reasoning, you're looking quite hard at the patient. It's very difficult to be sure about anything other than in retrospect. So you think, okay, I think 90% I think it's this, but then 5% it could be something else, 2% it could be something else, 1%, and you try your best in your examination. So then we go, okay, if this is what it is, this should help. Usually try some techniques and stuff in the session to see that, do you feel a bit better? Sometimes the assessment stirs people up. So again, it's a little bit hard to really tell. But then, then when they come back, is that help? Great. It hasn't helped? Okay, we move on to, then we'll try approach B or try approach C. But it's hard unless Of course, you can always go recommendations from other people that have seen someone. They go, this person was great, this person was great, or it didn't really help.
Yeah, well, that's how I found my guy.
All right,
and,
yeah.
And he has been good. He used to do the West Coast Eagles, and I'm a West Coast Eagles fan, so I get lots of we have lots to talk about.
Yeah. The actual connection with people is really important. That you actually that you feel you're engaging with your health professional or with your patient. You need to establish that rapport because most of what we do is communication.
Yeah, if I could ask you good versus not so good. So if you think back over the years and all the patients that you've helped,
Right.
What have they done that's led to, say, the best outcome when it comes to recurrent back injuries and back pain? And on the flip side, think of patients that haven't done well. What's the worst case scenario? Where have they ended up and what's happened to them? Just painting a picture of good versus not so good.
Right. Yeah. Okay. So the worst case, I'll start with the worst case scenarios because they're pretty horrific, really. The worst case scenarios are people that they might listen to what you say, but they don't do anything. They want to just come in and, I want to come in, lie down, you do something to me and I'm going to be better. So the really unrealistic expectations, and then the established pain behaviours of, I'm too sore, the only thing I can do is lie on the lounge and watch television. That's sort of the pattern. If you follow that pattern, then you are going to never be okay again. So worst case scenario of those people are, a couple of them would have had repeated surgeries and their ability to even do anything without pain is severely compromised. They would have permanent leg pain, great difficulty walking even 20 metres.
Affecting their quality of life every day. And
Yeah, they'll need someone to look after them. Certainly no ability to work or engage in any activity. So I've seen a few of those over the years, and some of them have already been close to that. But it's, the idea that it's someone else's job to fix me up and it's not really my responsibility, their own responsibility. Yeah, that mindset leads to disaster, always. Yeah, or the other thing that's really common, not to that extent, but this leads to is the carers and the mothers of the world who put everybody else before them. I don't really have time to do my exercises. I don't really have, I have to do this job because no one else is going to do it. I have to vacuum the house. I have to look after my little kid and continue to do the bending over, are unable to access supports. And that's also then really difficult if they've got a more serious problem to do much about. And I feel sorry for those people because with them, it's not just that that they're not grasping hold of the seriousness of the problem. It's just that their mindset is that everybody else is more important and they have to do all these other jobs before. But they often, the carers of the world often finish up in much worse shape than the people that they're looking after, because they're putting everyone else before themselves first and just blocking out. And a lot of mothers do that as well. So that's on the more negative side of things. The best ones that I've seen are people that listen and they engage in the process, that they are happy to spend maybe 2 or 3 months getting stronger and stronger, and they don't just get to I'm 60% better, I can stop doing anything now. They use it as a motivation to really get fit, and often they'll go from, say for instance, I've seen people that have gone from a can only just walk for 5 minutes to they're going to the gym and they're almost doing CrossFit sort of thing, picking up tires and climbing up ropes and running marathons and really have no issues at all anymore. But that's engaging seriously in a graded program and then continuing on from the point of view, once the pain's gone, then really carrying on from there to get the next level again.
That's great. And the reason for asking that question, Theo, is, our thread and our focus on prevention really matters. And having a back injury doesn't mean, as you say, it's a living tissue. You're not condemned to a lifetime of pain and restricted activity. Very much that right mindset, the commitment to ongoing therapy and an exercise program can really work wonders and create a world of difference in terms of the outcome that you end up in.
Yes, it's really astonishing how much better people can get. That's when I was in my 20s and working, it was I would be surprised at how well people were sometimes when I'd see them 4 or 5 years later. And often it was just from fairly simple interventions. As I said, just the basic, getting a little bit fitter, a little bit of postural work, I go dancing now, I feel great, I just don't have any issues. And it's one of the things that I really like about the Osana philosophy, and it's one of the reasons that I'm working there rather than where I was before, because it's really important to be thinking about the whole person and it's not some of those interventions are not specific for your back, it's just, but they will fix your back.
It's a good motivator for me to stay fit. I need a motivator, and not getting a bad back again is what keeps me going.
Yeah, absolutely. And for me as well. I mean, I'm inherently lazy, but it's like you see people falling apart, and you think, no, I can't afford to not do this stuff. You have to make the space in your life to keep yourself up there and be clear then about what it is that you want to be able to do, so that you can work to keep doing those things.
I'm lazy too, but when the choice is to carve out some time to do some basic exercise versus spend 3 months on your back, it's like, well, I can afford that less. So yeah. Theo, sorry, Kev, you go.
Yeah. No, I was just going to mention that, Theo, you've created some videos around managing sore backs, good posture, etc. So we'll be putting those up on our website for members. But yeah, just wanted to say thanks, and maybe as a way to end, the last question might be, over all your time as a physio, what's been perhaps some of the major changes that you've seen, and any observations on what's coming in the future in the world of physiotherapy?
Changes. The biggest change that I've seen in my time is the increase in modesty in patients. When I was a young physio, people come in and they take all their clothes off. It would be no big deal. Whereas these days, even people are very reluctant to show me their skin. And it's like, I think that's an interesting thing. That's cultural more than professional practice. I think one of the sadder things that I've seen is that there's now much more focus on assessment and measurement, which in itself isn't bad, but assessment and measurement is not intervention. And I think some of the intervention skills now, some of the aren't being used as much. we spend a lot of time generating reports and doing beautiful presentations, but not actually looking at, okay, well, we've got to actually do something for the person, not just measure what's wrong. And I think that needs to be changed. I think the biomechanics and anatomy of problems and the general going on, that's all fairly well understood. The big thing, of course, that's really coming is the quadriplegics and people that have had limb paresthesia is the mechanical arms with the neural interfaces. That stuff is mind blowing and is coming more quickly than we want. But I can't see, hopefully I'm wrong. I'm fairly careful with new things that come in. I wait till there's been around for 2 years, because you see things come, they're the great fashion, and then 2 years later they're not around anymore because they don't work, and they've replaced things that do work. And then sometimes those things that did work don't come back, and I'm going, oh, hang on, let's not throw away stuff that works until we really know that new things will work. And there's a lot more emphasis. I mean, I'm pleased about the increasing emphasis in exercise and those sorts of things. I think that's improved from 30 years ago. But I'm not sure that the actual physical management of problems has helped much. Oh, one thing that has been, I mean, it's not new, but the Lyrica, those sort of nerve and neuritis medications, they're much better than they used to be. But again, that's not my area of expertise. I just noticed, that works much better than whatever they used to do.
Theo, thanks for your time today. Hopefully, if there's people listening, that raises some awareness for them in case they ever need to go and see a physio about something that they've done or some problems that they have.
Well, good luck to all of you out there, and keep moving is the most important thing.
I like that message. That really reinforces what we're trying to do on the ground. So thanks again, Theo.
My great pleasure.